Hey there, people. This is my COVID-19 coronavirus guide. I usually do game guides, but right now we're dealing with something far more important, and I wanted to put my information gathering and explaining skills to good use. So I'm not a doctor. Please don't rely on me for medical advice, but I do have an education in critical thinking and math, so I'm going to try to explain this situation to all of you. I've done a whole bunch of reading and research, and I just really hope that this helps people. I encourage you all to share high quality information with friends and family. Don't get caught up in fear and hysteria. Stick to solid evidence and make your decisions based on that. I'll be tackling a few aspects of this. You might know some things already. You might want to refer back to this later. So I will be breaking it down into sections with timestamps, which I'll put in the description. I'll also be including tons of links to sources with good information so you can learn more. First of all, what does coronavirus mean and what is COVID-19? Coronavirus is actually a name for a whole family of viruses. It includes some versions of the common cold. Most are not a type of coronavirus, but common cold actually refers to a whole bunch of different viruses across at least a couple of different virus families. This virus is not a cold. It is not the flu. Influenza is a whole different family of viruses. It is somewhat related to SARS and MERS, which were smaller epidemics that passed over the last 20 years. COVID-19 is the most common name given to this unique virus. It is a unique thing within a larger family. It is believed, we don't have full solid evidence yet, but it is believed that it was originally transmitted from animals to people, and that that started in China. Of course, that's pretty well known. It is much more dangerous than a cold or a flu. It has killed, on average, about 1 in 20 people globally. It is actually less fatal than SARS, interestingly enough, but it spreads far more easily, and that's the real cause for concern with COVID-19, because that itself can cause much bigger problems. It has primarily killed older people or those with compromised immune systems, but that does not mean that it only kills those people. It has also hospitalized or killed many younger people and healthier people as well. So given quality care, the fatality rate may only be 2% or less. That's 1 in 50. But many people don't have access to care, and also the more people infected, the less care is available, and that's really what this whole crisis is about. Some places like Spain have reported close to 20% fatalities. That's 1 in 5, which is very worrying. But they may also only be testing people who are already sick, so that might skew the numbers as well. About 1 in 5 cases are expected to require treatment in hospital, as in you're going to have to go to the hospital and end up in a hospital bed. That's 4 to 5 that don't, but 1 in 5 might need a hospital visit. And about half of those people may require a ventilator to help them breathe. And this is really the crux of the whole issue. If too many people get infected all at once, there simply won't be enough hospital capacity, which means not enough doctors, not enough beds, not enough ventilators. And that's really what this comes down to. If hospitals become overburdened, then that means that the death rate grows higher, potentially much higher, because they're simply unable to care for them all. And that's really what all these lockdowns and the isolation is about. It's about trying to control the numbers. So imagine if we don't get a hold of this thing, 1 in 20 or potentially even 1 in 10 of the people you know dying. That's what all the worry is about, and that's what we're trying to prevent. Most people, you don't have to panic. It doesn't mean you have to freak out. Most people are going to get through this just fine. But to avoid as many deaths as possible, we need to all do what we can to keep ourselves and everyone else as safe as possible. That's really what all this stuff is about. So coronavirus symptoms. Some people don't even have symptoms, or many people have mild symptoms. And other people do have a more severe reaction, obviously. Basic symptoms are similar to a cold or a flu, including coughing, fever, and difficulty breathing. It's referred to as a dry cough. A lot of people feel like tightness in their chest, that kind of thing. And yeah, fever, which can pass quickly or can come and go. Apparently, it may even take away your sense of smell. That's been reported even in people who didn't have other symptoms, so that's something that might be a sign in absence of other signs. More advanced cases include chest pain or pressure, again, that feeling of like tightness or I can't breathe, that kind of thing. Confusion, even difficulty walking, bluish face or lips apparently have been reported. Some people do have symptoms like sneezing, runny nose, sore throat, nausea, and so on, but those aren't, kind of the general case. It can lead, in extreme cases, to coughing up blood, pneumonia, multiple organ failures, and death, of course. It is important to realize that since not everyone has symptoms, everyone does have to take precautions to avoid spreading the virus. You could have it and not even know it, or you could have it and it's like, well, it's not a big deal, I'm not worried about it, it's not going to hurt me. But other people could die because of your actions or your inaction. And so what can we do about it? You may have heard of social distancing. This literally means staying away from people. The recommendation is to stay away from people outside of your home 6 feet or 2 meters, or if one person in your home has it, same thing. But generally, it's when you're out of your home. This is because it's the only way that we currently have to keep yourself, your loved ones, and other people safe, and it ensures that our healthcare systems are not overwhelmed. Again, that's really what all these measures that are being taken and all these recommendations are about. It's about giving the doctors time to work. So to be clear, this means mostly avoiding people outside of your home, not in it. Unless you have a good reason to think that you or someone in your home might have the virus, you don't need to worry about people inside your own home. But if you do have serious symptoms, obviously seek medical attention. Like if it feels like if you get it and you think, or if you think you might have it and your symptoms are serious, like you're having trouble breathing, that kind of thing, seek medical attention. But try to avoid unnecessary contact at the same way. Call emergency services such as 911 or take yourself to the emergency, but don't take public transit. Don't go spreading it around. If your symptoms are not serious, a lot of people only have mild symptoms and they get over it and it's okay. So if your symptoms are not serious, simply isolate yourself. Stay home, isolate yourself as much as possible. Do not tie up the hospitals unnecessarily. They have enough to deal with already. It could be something else anyway. The regular cold and flu are still out there, so you could just have a regular cold or flu. If it's not, if it doesn't feel like it's potentially life-threatening, just stay out of it. Stay home, isolate yourself. Don't burden the medical establishment. Of course, symptoms or not, there are basic things that we all need to do, like getting groceries. But as much as possible, we need to keep our distance when we're outside of our homes and stay home as much as we can. So let's talk about what other precautions we can and should take. Wash your hands. For 20 seconds is the recommendation. Like, it's not just stick your hands into the water and we're done. 20 seconds, wash your hands properly. Particularly when you get home from being outside of your home. You could have touched something. You could have come into contact with it. So I've been doing this myself. First thing, get home, wash your hands immediately. When you're going to eat, if you're going to eat outside of your home, wash your hands. Try not to touch your face, your mucous membranes. That's your eyes, mouth, nose, ears, underarms, and other openings. Use hand sanitizer if it's easier while you're out and about, or wash your hands before you eat. Don't touch those places without having clean hands first. Use gloves if you need to touch a lot of things. Even going to the grocery store or something, you can wear gloves, disposable gloves, ideally. In this case, I'm not a big fan of garbage, but unless you're going to leave them for like 3 days after using them, disposable gloves. And wash after you take those gloves off anyway. Wash your hands, but don't overwash your hands, especially when you're already at home. If you're not bringing it in, you don't need to overwash your hands all the time, because you can wear out your skin's natural protection. So it's not like you need to wash every 5 minutes. It's mostly you're worried about bringing it in or things that could be contaminated with it. If you need to cough into your elbow. Best thing you can do, cover your mouth. In case you have it, you don't want to shoot it out into the world. So cover your mouth, cough into your elbow is the easiest thing. And that way you're still not getting it on your hands either. So, of course, be careful with outside food as well. For packaged goods, if possible, let it sit for about 3 days. They've found it on surfaces up to 3 days later. So if it's a packaged good, if it's not perishable, it's not going to go bad, set it aside for 3 days if possible. Stick it in the garage, whatever. For produce, wash it carefully, again, 20 seconds. Heating food should also kill the virus. Apparently, coronaviruses in general are less susceptible to cold than they are to heat. So sticking something in the freezer is less likely to help than sticking something in the microwave. The outside of the packaging is actually more likely to be contaminated than the food itself. So be careful with that packaging. One of the videos that I'm going to be putting in the description is like a doctor who's like full on sanitation, sterilization, and he shows you how to do it if you really want to be thorough. And hey, those people going to the grocery stores wearing masks and wiping their carts down with sanitizer, you know what? Even I thought it was overkill. I'm starting to think they're not the crazy people. They know what they're doing. You can't be too careful, right? Well, I mean, you can if you wear out your skin, but for the most part, you want to be as careful as you can, reasonably. The goal here is to stop it spreading too fast, because remember, if it spreads too fast, our healthcare providers are overwhelmed. They simply will not be able to treat everyone, and that will mean many more deaths. So it's all about slowing it down as much as possible, and I'm going to get into the numbers later. The goal is to keep the rate of growth as low as possible by staying home as much as possible. And, of course, taking other precautions as well. Community transmission is becoming a serious problem. That means cases that are from an unknown source where they don't know, they can't figure out easily who the person who has it got it from. And that's becoming a bigger and bigger problem. Since many people do not show clear symptoms or have, lower symptoms, it's important, extremely important, to be aware and to think about other people. Think about we rather than I. You do not want to be spreading this around. You could have it and you don't know it. Or you might not think it's a big deal for you. That's fine for you, but it's not okay for others. You could be putting others in danger. So if you want to enjoy the spring weather, in a lot of places it's getting nice outside, do it from your balcony or your backyard. If you really need to go outside and you don't have a yard, go somewhere where other people are not. Do not go to a crowded space. Every additional person on the streets is an additional risk to themselves and to others, whether they have it or not. Everyone else. If you do go out, keep your distance from people. 6 feet, 2 meters. So let's look at the numbers. Well, first of all, let's pretend I have it. And I have developed a little cough since yesterday, so who knows? I could. If I lock myself down completely, I order my groceries online, I have them drop it outside the door so there's no contact with the outside world, I never leave, I can avoid spreading it. That's perfect. No one gets it, I get better. That 1 becomes a 0. Of course, in the bigger picture, life is far from perfect. So let's say I'm very careful. I stay at home. I take precautions. Maybe somewhere along the way I slip up a little and someone gets it from me. Could be the delivery guy, could be a neighbor. Maybe I take a quick trip to the store and I wasn't as careful as I should have been. If everyone else is also very careful, only one person gets it from each other person. That's what they're talking about when they say flattening the curve. The number of cases doesn't keep growing. Gradually, most of us get better. This is what we're seeing in a few countries who have done extremely well at locking things down. South Korea, Taiwan, a couple of examples. But let's say I'm careful. I'm not quite so careful. I mostly stay at home. I avoid people, but I could have done better. A couple people get it from me. They do the same. They're careful, but not extremely careful. A couple people get it from each of them. The number of cases starts to double, then double again and again and again. Those numbers keep growing faster and faster. The healthcare system starts to struggle to keep up. Just from spreading it even 2 at a time, a lot more people could die than should have to have died. This is what we're seeing in places like Italy and Spain. Obviously, my models are extremely simplistic. I drew some stick figures on a blank sheet, but this is what we're seeing in places like Italy and Spain, and so far it's the direction it's going in the United States. And if we're careless, it can get a lot worse than that. It's not hard at all for one person to infect 10 others. That's why in most places, large gatherings have been banned. In a crowd of 100, one person can infect 30. So let's say I infect 10 people. They infect 10 each. That's 100. 10 each again, that's 1,000. Then it's 10,000, 100,000, a million, 10 million, 100 million. There's no way the healthcare system can keep up with that kind of thing. 1 million people could die that way in the US alone. There have been projections that have suggested that's quite possible. And that is why we all need to be careful. We all need to do our part, sick or not. Remember that people can have the virus with no symptoms. I'm going to repeat that again. Or they might only have mild symptoms. And yeah, you might not be worried about that. But you have to consider other people. It can take up to 2 weeks for symptoms to appear. All of those people, symptoms, no symptoms, mild symptoms, can still spread it around. The numbers we're seeing reported in the media and elsewhere are only the confirmed cases. Many people could, and in fact many people do, have it and do not even know it. We don't know the real numbers. This is why we have essentially quarantined ourselves as much as possible so that other people, so that people who do get it, get over it before they pass it on to others. You isolate yourself, you don't go around passing it around. And that's the idea. By simply staying at home, we are far less likely to get it. And those who do get it are far less likely to spread it. In many countries, the growth is accelerating from a small number of cases, doubling every few days. And this means even if those numbers are small, it is far from over. So what's going to happen? If we self-isolate, as many of us and as much as possible, things could get better soon. Those cases will start to flatten out and eventually drop off, and our healthcare system will be able to keep up. If we don't, if we go around and we don't care about it and we don't worry about it, we will all be the victims of our own collective recklessness. So listen to the experts, the real ones like doctors, and share information only from reliable sources. Understand that while scientists around the world are working on this around the clock, looking for a cure or a vaccine or a treatment, that will take a long time. Vaccines are expected to be a year or more away. So we all have to do what we can, and we have to let the community work, the medical community, by doing what we can and by reducing the exposure to the population and to them as well. Of course, many people are worried about their jobs or the economy. Of course. And I know that I am extremely lucky to be able to work from home. I already work from home anyway. I hope that most of you can make it through all of this. A lot of governments have been announcing aid packages to help people through all of this. But if we don't take care of this, millions could die. and that will be much worse for the economy. Remember that no one is actually immune to this virus, except for the few people who have gotten over it. Some are more susceptible than others. The outcome depends on our individual and collective behavior. This thing could go on for a couple of months if we all isolate ourselves very strictly, we don't pass it around, or it could go on for a year or more. And think about the impacts of that. If we take it seriously now, it won't be as bad later. The impacts on jobs, the economy, the death toll, and so on depends on all of us. Different countries will handle it better or worse, with better or worse outcomes. The overall global impact will be the cumulative result of all of that put together. Now is the time to show compassion. Try not to be selfish. Be conscientious buyers. Buy only what you actually need for the next little while, please. Do not take advantage of other people's desperation. Help your neighbors if you can, the elderly and other vulnerable people if you can, but do not put them in additional danger. Many at-risk people are unable to get basic supplies because of panic buying. Toilet paper, anyone? Crowding the grocery stores is only going to aid the spread of the virus. More people in the store, the more likely it's going to spread through the store. So you are also putting other people and the workers in those stores at risk if you're there and you don't need to be. We need to stay home so that they can do their jobs and to reduce their exposure as well. Not only that, you are hurting your own wallet when you buy more than what you need. Do you need 5 closets full of toilet paper? No, you don't. Personally, 1 pack would last me probably a couple months. I'm pretty, light on my usage, but we must show solidarity. We have to think about each other. Our governments are trying to deal with this, and they need our help. Even more, our doctors, nurses, scientists, and others are trying to deal with this. The frontline workers, think about them. We need to stay at home so they can do their jobs and to reduce their exposure. In the past, people have fought wars so that we can enjoy the prosperity that we've taken for granted. Many of those who fought and who are still with us are elderly. They're getting old now, and they're in danger from this virus. We owe it to them. We have a duty to them, those who fought for us and are still with us, to do our part. And all we have to do, the best thing we can do, is stay home. It's not so bad. I hope this has been useful for some of you, and I hope this helps. If it saves one person, I'll be happy. And this is a weird thing to even talk about in this situation and after all of that. Let me know if you'd like to see more vlogs. I've sometimes thought about even starting a vlog channel just about life topics. I don't know if that's something that any of you would like to watch, but let me know if you have thoughts on that. Maybe I could start another channel and talk about other subjects in life as well. I do have a bit of experience. My beard is turning gray now. In the meantime, if you like game guides and or Terraria, that's what I do on this channel, so please subscribe here if that's true. If you need some mindless entertainment, I have a second channel called Mass Distract Gaming. Check that out if you like. Most of all, thank you for watching. Take care of yourselves. Take care of each other. Much love to all of you.